everyone. I am Dr. Shalini Gupta at the Dermatology Laser and Vein Center, and today I am going to talk to you about the Thermage procedure. So Thermage is one of my favorite procedures because it was a big excitement when it first came out in the year 2002, and I remember driving up to Chicago for the American Academy of Cosmetic Surgery conference, and there was a room full of doctors, and Dr. Tavares presented the Thermage procedure at that time, which was a brand new type of indication using not a laser, because up to that point we had a lot of lasers to treat anything from hair removal, laser skin resurfacing, facial vessels, brown spots, and so on. But this is the first time a new type of energy was introduced called radio frequency, and there's no recovery time with radio frequency energy because it penetrates deep through the skin, sparing the superficial skin layers. And it was the very first time that a non-surgical facelift was shown in before and after images on the screen, and the entire room just went completely hush. And then there was a lot of whispering and murmuring and excitement about this new technology, which for the first time could compete in a way with a facelift and give what we call a non-surgical facelift. So this was the original non-surgical facelift. Now, of course, in today's world, fast forward 18 years, we have other technologies that are able to give skin tightening as well in a non-surgical manner. One of my favorites being using focused ultrasound with a procedure called Whole therapy. But today we're going to focus on Thermage because it is still an excellent procedure, and a lot of our patients have received really nice results with Thermage, and they continue to come back and repeat the Thermage procedure over and over, especially if it has worked well for them in the past. And also Thermage has gone through an evolution. The procedure used to be really slow. I remember 8-hour, 10-hour days where all I would be doing is firing the Thermage into the skin. And now the procedure goes a lot faster, and we're able to see even better results with the upgrade in technology over time. So there are different parts of the body that can be treated with Thermage. One of my favorite areas to treat is actually the eyelids. And Thermage is the only FDA-approved non-invasive procedure to help tighten the eyelids. And the procedure is done with a really small little footprint probe that is literally just applied to the skin, and then the energy is pulsed through this probe directly into the skin, and it heats the tissue, and then over time helps to build new collagen fibers, strengthen the skin, and also improve the skin texture. So we have seen really nice results in being able to tighten up the hooding in the eyelids, and then I also administer it to the lower eyelid, and we get an overall nice tightening effect of the eye. Thermage can also be used to treat the face with what is now a face tip. Originally we only had this size tip, but now we have multiple different tips and also tips that treat cellulite. But this is a face tip or a total body tip, and it can be applied to the face, the neck area for tightening, and you can also use it in the body. Although usually when we're treating body areas now, we use this much larger tip, which has a much bigger footprint and does a great job of tightening areas around the legs, the arms, the stomach, and other body areas. So I will show you some pictures and also explain to you a little bit more in depth about how this technology works. So what does Thermage actually do? So the heat transmits through the skin with radio frequency, and it helps firm up these subcutaneous bands of tissue. And it also helps to build new collagen in the skin at the same time. And these effects, again, are seen over time. So you won't see an immediate change with Thermage, although there's usually what's called a thermoglow right after a procedure where one just looks really refreshed and energized. But over time, the tightening effect and the contouring effect continues to happen. this is how the procedure is actually administered. Again, these are the probes that lay on the skin, and then the heat just transmits right through that. Like I said, there's no recovery time with this outside of just a little bit of mild redness, maybe a very mild amount of swelling, but you can certainly go to a social activity immediately after a Thermage treatment. So during the procedure, with each pulse, first there is a cryogen cooling that occurs to the skin. And the cooling continues throughout the length of the pulse while it is transmitting the heat then into the skin. And the probes each have on the corners little thermistors, so they're constantly monitoring the temperature and making sure that the right amount of energy is getting into the skin. Patient feedback is also extremely important during the procedure because we don't want to overtreat the area, we don't want to undertreat. So usually we'll ask a patient on a scale of 0 to 5, what are you feeling? And if you are at around a 2 or a 3, that's the ideal number. That way we know we're getting enough heat into the skin but not overheating. And early on with the Thermage, some of the plastic surgeons especially were getting a bit aggressive with the procedure, hoping for even better results if they got aggressive. But what was happening is there was actually some heating of the subcutaneous fat, and it was causing some fat loss. So that we want to absolutely avoid, especially in certain parts of the face and the body. Now in certain areas of the body, we may actually want to get a little bit of fat reduction, and we will use the larger tip in that case to transmit more heat at one time. But for the face, we really rely on that feedback so that we keep the procedure safe and we get the nice results. These are some examples of the Thermage before and after. This is an eye lift. This is an improvement in the neck and jowls. And then here you can also see a nice straightening of the jawline, lifting of the nasolabial fold, and also look at the malar pads here, how much nicer and fuller they look. And also you will notice overall a skin texture and quality improvement. So here is another example of a before treatment, right after, 2 months, still not a real appreciable change, but then once you get to 6 months, you can really see it. So one thing with the non-invasive procedures is that these are not procedures where you should stare at your face every single day to look for an improvement, because what happens is you start getting used to the subtle differences that are happening. And so when you're at 6 months, you might be like, oh, I don't know if anything actually happened. But then when you look at before and after photos, that's where you can really tell that there has been a change. It's just been so gradual that you may not have even noticed. But a lot of times patients will tell us their friends who haven't seen them in a while, they will definitely notice. So you may not, but others will, and the photos will show it. So that's always exciting. And these are some more examples of the chin and jawline straightening, eye lift, eyebrow lift. Some more examples of the chin and jowls. Really nice improvement in the submental areas, here and here as well. And again, you'll really see this improvement in skin quality and texture as well. Here's another improvement. And one other indication that I absolutely love treating the face for with Thermage is patients who have cystic acne. So not just for skin tightening, but in younger patients or older patients who have persistent cystic acne. Let's say they don't want to go on Accutane, which is a fairly serious medication for acne, and they want to do something a little bit more natural without a systemic effect on their body. Thermage is an excellent tool for actually shrinking those sebaceous glands, and that was found as an incidental benefit when the Thermage procedure was being performed. But now we really like to offer this as an option for our patients who have those deep cystic lesions, because it will actually heat the sebaceous glands and cause them to shrink down, and we can get Accutane-like benefits without needing to go through 6 to 8 months of systemic treatment with potential side effects. So parents love it and children love it, and all of our patients who have cystic acne so far really found that to be beneficial. These are some more examples of how the Thermage procedure can help lift the eyelids and get rid of the hooding of that skin of the brows. Here's another example. And then the body treatments. Again, we see really dramatic improvements in skin tightening with the Thermage procedure. It's a single treatment. Some procedures require multiple visits. With Thermage, it's meant to be a single treatment, though it can be repeated. We will usually tell a patient to wait at least 3 to 6 months before deciding if they want to repeat it to get further results. But results will continue to get better over 6 months, even 12 months, as the skin heals itself and builds that new collagen. These are examples of treatment to the arms. And then one of my favorite areas to treat also is around the knees, sort of that anterior front of the leg and around the knee area where you start getting that crepiness and you don't feel like wearing shorts or your mini skirts any longer. And then the hands can also be treated with Thermage and give sort of a nice plumping effect to that area. Other things we can do for our hands too are laser treatments to get rid of sun damage, resurfacing treatments to smooth out the skin. We can also add filler between the bands and then get rid of the vessels. So those are just some other things about hands that can be done. And then I wanted to show you also one of our recent patients. She's had Thermage in the past, but this was just recently. She had jowling and a prominent neck here, and went from this to this within a matter of a few months. And you can also see a really nice improvement in skin texture and quality at the same time. So that is the Thermage procedure. I hope this was educational for you and that you learned something, and we look forward to helping you. Have a wonderful day.